So what controls urination, and this is a cartoon depicting the neurologic control over it. It actually is a conscious, although it is a reflex, it's a consciously controlled reflex. The lower urinary tract, the bladder, and the urethra are under autonomic nervous system control, both sympathetic and parasympathetic, and the SNS is sympathetic nervous system, and the PNS is parasympathetic nervous system. The muscles of the bladder and proximal urethra are smooth muscles, so those are under autonomic nervous system control. The distal muscle of the urethra, and depends on male, female, and dog or cat, is skeletal muscle, and so that is under somatic control, which is what we consciously control. The parasympathetic nervous system mainly controls the bladder muscle, that is bladder contraction, where the sympathetic nervous system primarily controls storage. And so by stimulating the alpha adrenergic receptors in the urethra, that causes the urethra to tighten. And while stimulating the beta adrenergic receptors in the bladder, that causes the bladder to relax. And that's very similar to what occurs in smooth muscle of blood vessel walls or the intestines. The alpha and beta receptors oftentimes work opposite to each other. And then again, this is a conscious process, and so there is a Micturition center that is in the brainstem, as well as nerves that radiate to the cerebral cortex, so that you're aware, or the dog or cat is aware, that you have to urinate, and we consciously don't allow urination to occur. And when we find a spot where it's appropriate, then we consciously, or the dog or cat consciously voids. Next slide. Again, this shows the myogenic components, the muscle part of it. It's out of a textbook chapter that shows, again, that the smooth muscle is what the muscle is in the urinary bladder, the detrusor muscle, and then the smooth muscle of the internal urethral sphincter in both males and females. And so the question then is, what controls neurologically, what controls what? So the next slide, slide 6, in the bladder and the urethra function opposite to each other. And so when the bladder is relaxed and urine storage is occurring, the urethra contracts. When voiding occurs, the bladder contracts and the urethra relaxes. The parasympathetic nervous system is the primary innervation to the urinary bladder, and that's what causes the bladder to contract. And so the way to remember it is that parasympathetic promotes peeing. The sympathetic nervous system stimulates storage, and so what it causes is contraction of the smooth muscle of the internal urethral sphincter by alpha receptors and relaxation of the detrusor muscle by way of beta receptors.